Uterine artery Doppler as a predictor of preeclampsia. We shall see a case example in a 25-year-old with previous eclampsia, currently at 24 weeks of gestation. Generally, degeneration of the muscle layer, loss of spiral nature, and massive dilation of the spiral arteries begin by the 12th week of gestation. So around this, we expect the resistance to be high. The normal waveform of the uterine artery is a high systolic and high end diastolic, typical of low resistance. But high resistance flow may be seen from 12 weeks up to around 18 weeks. But high resistance should not be seen beyond 18 week of gestation. This case was seen as 18 weeks. Resistance here is high, including matching here. So this was the case of preeclampsia. This pattern should not be seen by 18 weeks. What we expect is a low resistance pattern like this. The uterine artery assesses the maternal compartment, while the umbilical artery assesses the fetal compartment. The uterine artery is a good screening tool. It is also used as a diagnostic tool in late onset fetal growth restriction. Now let's look at a few indications for uterine artery Doppler first trimester as part of screening for preeclampsia in case of coronary hypertension, in fetal growth restriction, in autoimmune disease, either acquired or hereditary hemophilia. This was the indication for the screening in this patient. She had eclampsia in her last pregnancy. So, what were the findings? At 24 weeks, look at the right uterine artery spectral waveform, the left uterine artery spectral waveform. Generally, by eyeballing, we always confirm that this is low resistance. Why? Because the difference between the peak systole and end diastole is less than 50%. So this suggests that this is low resistance flow. But if you look at these two, you realize that the resistance here, even by eyeballing, is higher than this, because the difference between this and this is slightly more than 50%, but here is less than 50%. But as you can see, objectively assessed, the PI is 1.05 on the right, 0.76 on the left. So this suggests that the placenta is likely to be implanted on this side because this has low resistance. So this is by eyeballing and this is by objective measurement. We can also use calculators like a fetal medicine calculator to have an idea about where the paucity index falls. Here you can see the right uterine artery, left uterine artery. If you add the two, what you have is 1.81. We take the mean, 0.9. When you impute it here, shows that 24 weeks, 2 days, uterine artery PI, the mean is 0.9. So you can see this is normal. This is normal uterine artery at this gestation age. So this patient had previous eclampsia. So she's at risk of another eclampsia. But at 24 weeks, there are evidence of remodeling, suggesting that this patient is unlikely to develop preeclampsia in the current pregnancy. Secondly, this patient presented at 24 weeks. She has missed the opportunity of the benefits of low-dose aspirin earlier in pregnancy. But major guidelines like the AGOP, NICE, WHO support initiating local aspirin up to 28 weeks in women who are at high risk if they present late. This patient is a high risk. She presented late. So we also commence now on low dose aspirin. So now look at this index case here. Resistance in the right, in the left, low resistance pattern, suggesting remodeling. Compare with this at 20 weeks, this at 18 weeks. This is very high resistance. Look at this with notching, and this one also high resistance with notching. But remember that this is a transabdominal and this is a transvaginal image. And the PI is higher when you're using transvaginal than transabdominal, and that must be taken into consideration. So the patient presented at 40 weeks, 3 days. At 40 weeks, the umbilical artery is the preferred and more clinically useful vessel to assess. Remember, the uterine artery assesses the maternal compartment of the placenta, while the umbilical artery assesses the fetal compartment. So what we are interested in at 40 weeks is no longer the uterine artery, but the umbilical artery. And look at the umbilical artery flow. Look at the normal diastolic flow. This is reassuring. But remember, the Doppler only picks placenta damage if it's more than 30%. What it suggests is that even if there's placenta damage here, it's not up to 30%, and it cannot be picked by Doppler. So this is normal Doppler PI, as you can see here, 0.76 at 40 weeks, 3 days. Even by eyeballing, this is normal. But if you assess objectively, you can see that. But again, you can use a fetal medicine calculator. The session at 40 weeks, 3 days, PI 0.76, look at it, normal. So this patient demonstrated normal uterine artery remodeling at 24 weeks gestation, indicating a low risk of developing preeclampsia. So despite being clinically high risk due to eclampsia in a previous pregnancy, low dose aspirin was commenced late at 24 weeks. So it's really not clear whether the absence of preeclampsia was attributed primarily to the physiological uterine artery remodeling, even on Doppler at 24 weeks, or the late initiation of low dose aspirin. Whatever it is, the patient is happy, but more than baby. Okay. So thank you very much for listening.